Hello everybody and welcome to this month's team video. Well, here I am on Swift Ward with colleagues to talk about a campaign we're launching on Monday, Red to Green, Make Every Day Count. So tell us a little bit about that.
So I think it's quite individual, but on our ward, what it's done quite nicely is frame the end of a conversation, of a board round discussion about that person's journey through the hospital.
If you are red,
Yeah.
something is stopping you from going home.
Then we set out what needs to be done for the rest of the day, or what jobs need to be done with our bloods, etc, etc.
Once you turn green, that's your moment to now be able to leave the hospital, or your journey in hospital has ended.
In a way, Red to Green is really about that part of the pathway that enables a patient to move from the end of their acute care intervention home or wherever they want to go.
That's exactly right.
And making every day count is a sort of slightly broader philosophy, which is from the moment the person enters the hospital's care, everything we do should be meaningful, help that patient on their journey to getting better or addressing the issue they've arrived with. I suppose some of our colleagues in the rest of the organisation might say, well, what are you saying? That at the moment, every day doesn't count?
So we talk on this ward particularly a lot about how someone's last 1,000 days wants to look.
Right.
People don't realise they can have influence over that.
Yeah.
And actually, people may not want it looking the way that we want it looking. So we can have that conversation. If a nurse has made a good bond with them, then they can start having the conversation.
Yes.
Equally, if a ward clerk's had some experience speaking to relatives, then they can. A doctor can. But it means that you can start having those difficult conversations with someone who's built a rapport with that person.
So talk us a little bit about the process that you've implemented then as an example.
So one of the biggest things that we tend to do, and this is something that is part of the fabric of how we run things, is essentially to determine each patient on our board rounds in the morning at around 8 o'clock in the morning,
Right.
with the multidisciplinary team, the MDT,
Yeah.
about basically what needs to be done to get this patient out of hospital.
I think sometimes it can get so busy that people are not clear of what needs to be done.
Yeah.
So it gives you a very easy way to say what needs to be done and follow it up and escalate things where they need to be escalated or investigate them where they need to be investigated.
What I challenged the team to do was to be able to think on their feet and actually be able to respond to every changing scenario, and actually realise that each individual patient isn't going to be managed the same, but actually the outcome should be the same for all of them effectively.
So it's not changing anything we do, it's just coordinating it. You need to have a leader, but equally I'm quite happy and quite encouraged to people to challenge me.
Yeah.
Because that's part of it. So if I'm saying something that's not quite right from their point of view, then let's challenge it.
Yeah.
So at the end of that board round, we have a cohesive idea about how that patient's journey is going to look.
It sounds brilliant. It's got benefits for the team
Yes.
and the patients and of course the whole organisation.
Yes.
Has it changed your experience of working on the ward and working with the team?
Yes, the team works better as a coordinated team, and I think that's good. And also team bonding. We're more of a team. I think that's lovely.
We all share the workload. I quite often sit in the bay
Yeah.
and keep an eye on the patients when perhaps say the nurses are busy.
Each member of the team takes responsibility for an action,
Yeah.
and if that can't be achieved by that particular individual, somebody else can step in. I think that's exactly the notion that should be sort of given to other people in their own way, for whatever it works on their particular units or areas.
You know, this whole approach really fits with our 4 Ps, doesn't it? It really does. So thank you for sort of bringing to life that whole piece around personal responsibility. I think what I've really learned talking to colleagues this afternoon is that whilst this is a great initiative for ensuring that the patient care is delivered safely, effectively and efficiently, and that patients aren't delayed by poor management or poor communication, what I've really heard is that this is about the team. This is about creating an empowered team, the clinicians, the administrative staff, the patients as partners, their families, and really that team coming together around the patient's needs and then taking that team effort and really making a difference for the patients. You can take this philosophy, you can personalise it to your patients and your team, but come together, and I know lots of you are already doing this, but we really want to make a big effort over the coming weeks and months to think about how we make every day count for our patients.